Pragmatic Language Skills, a Case Study. Group 3, Caroline Foreman, Angel Hovey, Lauren Muller, Hannah Schwarr, Ivy Shuford, Lauren Vickery.
Our case study is about Jane, a 27-year-old female who sustained a severe TBI following a motor vehicle crash 3 months ago. Jane has transitioned through the RLA levels as predicted and is now at level 6. She was recently discharged from the rehabilitation hospital, and today is her first day in outpatient treatment. She has already received a full battery of standardized tests, so we are able to begin treatment.
On the Rancho Los Amigos cognitive scale, Jane scored a 6. This is characterized by confused, appropriate, moderate assistance. Some examples are inconsistently oriented to person, time, and place, able to attend to highly familiar tasks in non-distracting environment for 30 minutes with moderate redirection. Remote memory has more depth and detail than recent memory. Vague recognition of some staff, able to use assistive memory aid with maximum assistance. Emerging awareness of appropriate response to self, family, and basic needs. Some other examples include moderate assist to problem-solve barriers to task completion, supervise for old learning, an example would be self-care, shows carryover for relearned familiar tasks, another example would be self-care, maximum assistance for new learning with little or no carryover, unaware of impairments, disabilities, and safety risks, consistently follows simple directions. Verbal expressions are appropriate in highly familiar and structured situations.
Jane has completed college. Prior to her TBI, she was a sales manager for a drug company, which included lots of travel. She landed this job right out of college. She has 2 brothers and a mother and father. She has a rich network of friends. She is engaged with a wedding plan for summer of 2017. She had no health issues prior to her TBI. She currently lives with her mother and father. She lived alone prior to her TBI. Patient goals: return to work, live alone, pass a driving test, socialize with her friends, plan her wedding with her mother.
According to Brookshire, pragmatic impairments affect the social and interactional aspects of language, such as turn-taking, topic maintenance, social conventions, and eye contact.
Social communication skills training. Social communication skills training begins with the identification of problem behaviors such as awareness of social rules and the self-monitoring of speech and language skills. Desired replacement behaviors are then modeled for the patient. Practice during this treatment is often seen in role-playing activities and feedback through discussion from groups and clinicians. Skill transference is then often encouraged through homework-type real-life situations with the client and/or communication partner or caretaker bringing back a report on how the interaction went.
Jane's long-term goal is to increase independence of overall social and interpersonal communication skills, as well as nonverbal aspects of communication.
Short-term goal 1. During treatment interactions, the client will make eye contact with the clinician when provided with the verbal cue in 4 of 5 attempts. The clinician will teach the client the look at me cue and instruct the client to look at him or her when prompted during interaction. The clinician will model appropriate eye contact for the client. The cue will be provided consistently during interaction between clinician and client. Treatment task. The clinician and client will discuss an upcoming social gathering, client's engagement party. The clinician will prompt the client with the cue, and the client will look at the clinician in 4 of 5 attempts. When the client consistently responds to the clinician's verbal cue, the cue will begin to be faded and replaced with client self-cues. Providing the client with specific points to make eye contact can assist the client during the transition from clinician to self-cues. The clinician will also provide a structured method for client to continue to maintain appropriate eye contact in conversations. Level 1, make eye contact when beginning and ending an utterance. Level 2, extend eye contact to the beginning and ending of the conversational partner's utterances. Jane's mother and friend often accompany her in therapy sessions. Upon successful treatment task between client and clinician, Jane's mother and her friend will also participate as interaction partners to facilitate appropriate eye contact and generalization outside the therapy room. Conversations will be related to Jane's upcoming wedding. Short-term Goal 2. While watching a talk show, the client will identify appropriate and inappropriate turn-taking behavior with cues provided by the clinician in 4 of 5 attempts. Prior to engaging in the treatment activity, the clinician will explain and model turn-taking rules and how conversational partners know when to take or give a turn. Example given, eye gaze from the speaker, pause time, etc. The clinician and client will practice without regard to other aspects of communication. Treatment task. The clinician and client will watch a segment of videotaped television talk show, such as The View. During the show, the client will identify appropriate or inappropriate turn-taking by using a red card for inappropriate and a green card for appropriate turn-taking. Cues will be provided by the clinician. As the client becomes reasonably adept at identifying normal turn-taking, other treatment activities may involve turn-taking and include free conversation with the clinician, family members, groups, or participants of the client's choosing. Tasks will also be assigned as homework for the client with a caregiver, family member, friend, whereby they will use their phone to video record a conversation between them, which is related to an upcoming social event that Jane will attend with her family. The conversation will be judged in the following therapy session, and feedback will be provided by the clinician.
All right, Jane, so today we're going to be working on turn-taking behavior, and we're going to be watching a video from the talk show The View. And I have these 2 pieces of paper. Green means that they exhibited a good turn-taking behavior, and red means that they exhibited a bad turn-taking behavior. So before we start, what is an example of good turn-taking?
I guess if you waited until the person was done talking.
Yeah, that would be a great example. Waiting until the person finishes speaking. And then what would be an example of bad turn-taking?
I guess if you interrupted someone.
Yeah, talking when somebody else is talking is not good turn-taking. So let's watch the video, and I'm going to give you these pieces of paper, and I want you to hold up green for good and red for bad turn-taking. Are you ready?
I'm ready.
Okay.
There's a call for an Oscar boycott. They're getting louder and louder over lack of diversity among the nominees. But here's my question. Why is this a conversation that we only have once a year? Because every year we get all fired up, and then the rest of the year nobody says anything. These movies have been coming out. We've been going to see them. I'm sure people notice when there's lack of diversity in the movie. So why are we speaking about it now? Christmas, we talk about it once a year because there it is in your face.
Great. So why was that a good turn-taking?
I think, she waited until she was done talking.
Perfect. Yeah, that was a really good
It's
example.
the same thing. And here it is again. But it's in your face all the time when you go to the movie. This is the lightning rod. I think that just reminds people of how light.
So what just happened there? Did you catch any talking, any bad or good behaviors?
I don't think so.
Okay, let's rewind it and watch it one more time.
Think about it now. Christmas, we talk about it once a year because there it is in your face. It's the same thing. And here it is again. But it's in your face all the time when you go to the movie. This is the lightning rod.
Oh, I guess she did kind of interrupt her.
Yeah, they both kind of started to talk at the same time, and this lady right here didn't wait for that lady to talk, even though she started first. So that would be an example of bad turn-taking. Let's keep watching.
I think that just reminds people of how light and how people are worded. And I think, we always think
That was a good example of
because last year
waiting.
there was that hashtag Oscars so white, and we had this conversation last year. I really 2 years ago, and I really thought it was going to get better this year. And I'm actually surprised it isn't better because when you look at the stats, 46% of the 1.2 billion in movie tickets sold in the U.S. in 2014 were purchased by African Americans. 46%. But you're not nominating people seeing the
What just
That
happened
was kind
there?
of bad. She did cut her off a little bit.
Yeah, they were both talking at the same time, and this lady right here didn't even wait for her to finish her thought. That was a bad example of turn taking.
In the movies, and the real problem is there aren't a lot of movies that feature African Americans. We've been great this year, where Stallone was the only actor nominated. The irony of that, not lost. He went straight out of Compton. The only people nominated for that were the two white writers. So there are issues, and there's real purchasing power. That's my point. And so
What was that? Was that a good example or a bad example?
Is that a good one?
That was a good one. Why was that a good one?
She waited until she was done talking.
Yeah. She waited until she completely finished to start her new thought.
If you look
Let's
at
do
Ride
one
Along
more.
2, which came out this weekend, it bumped Star Wars out of the #1 spot. Okay, but Ride Along Star Wars nominated anything.
What about that one?
I don't know.
Let's watch it one more time.
So I'm sort of surprised at that. If you look at Ride Along 2, which came out this weekend, it bumped Star Wars out of the #1 spot. Okay, but Ride Along Star Wars nominated anything.
I guess that would be a bad one. She was still talking.
Yeah, that would be a bad example of turn taking. Great. So that's a little example of watching a TV show and choosing bad turn taking or good turn taking. Your homework this week, until we meet again next week, is to look in everyday situations. I want you to try to observe some good turn taking and some bad turn taking. And I want you to come back next week and let me know what you saw was some really bad turn taking situations and times where you saw a good turn taking.
Okay, that sounds good.
Great.
Short-term goal number 3. During a structured activity, the client will identify and maintain the topic given only 2 cues from the clinician per scenario in 3 out of 6 attempts. Prior to engaging in the treatment activity, the clinician and patient will discuss how conversations usually have a central theme or topic that lasts through several conversational turns and how certain behavior can demonstrate a shift in the topic. Treatment task. With the help of either Jane's mother or friend, the clinician will demonstrate role play. The clinician and one of the aforementioned participants will act out a scenario. The clinician will then ask the patient to first identify what the topic is and then ask a follow-up question about the scenario. If the patient is unable to get the topic identification question correct, the clinician will give up to 2 cues per each scenario. If the patient is unable to choose the correct answer after cueing, the scenario will be marked as incorrect. Each treatment task will be videotaped and used to provide feedback to the patient and document their progress with the task. Upon successful treatment tasks, cueing will be removed and an eventual shift will be made where Jane will participate in structured conversations with a group of people. Short-term goal number 4. During a structured activity, the client will ask 2 questions requesting more information when given up to 2 verbal cues per statement from the clinician in 3 out of 6 attempts. Prior to engaging in the treatment activity, the clinician and patient will discuss why it's important to ask questions during a conversation and some types of questions that can be asked. Treatment task. The clinician will have a sheet with multiple statements such as, "Guess what? I just got a puppy," or "I am so tired after everything I did today." The client is to ask at least 2 questions to find out more details from the clinician about the statement. After the statement is read, if there is no response from the patient within a 5-second time frame, the clinician will give a cue along the lines of, "What is something that we could ask to find out more information?" This can be done up to 2 times per statement. If the client is unable to ask a relevant probe question after cueing, the statement will be marked as incorrect. Upon successful treatment tasks, a shift will be made requiring Jane to participate in structural conversations with a group of people. Cueing will still be provided if necessary and then slowly faded out.
Hi Jane, how are you today?
Hi, I'm good.
Good. So today we're going to be working on requesting more information. And to work on this goal, I'm going to be giving you a few statements and I want you to ask 2 follow-up questions related to my statement. So for example, I could state, "I saw my favorite movie this weekend," and some follow-up questions you could ask are, what is your favorite movie, or what's your favorite movie about? Okay, are you ready to try? Great. So what if I said, guess what? I just got a puppy. What are some questions that you could ask me relating to that?
I guess I could ask, what kind of puppy?
Yeah, that'd be a great question. What about one more?
When did you get the puppy?
Yeah, that's a great question too. What about, I'm so tired after everything I did today?
Maybe I want to know, like, what did you do today
Yeah,
that made you so tired?
that would be a great question. Do you have any more? So maybe another example could be, are you going to go home after this and rest since you're so tired? Got one.
Oh, another one would be, did you not get enough sleep last night?
Yeah, that would be a great question. What about Marcus is in the hospital?
Oh no.
Yeah, or Marcus.
I guess I want to know why he was in the hospital.
Mm-hmm. That'd be a good one. Maybe we could ask, who's Marcus, if you didn't know who that person was. Any more?
Maybe. How long he was staying there?
Mm-hmm. That would be a great question. How about my dad is in California this week?
Why is he in California?
That's a great question. That's pretty far.
Oh.
How about where in California did he go?
Maybe how did he get there?
Mm-hmm.
Took a plane.
Yeah. Great question. How about my sister didn't go to school today?
That's a shame. I guess I want to know why she didn't go to school.
Mm-hmm. Mm-hmm. What about one more?
Maybe what she was doing.
Mm-hmm.
What she was
Yeah.
doing all day.
What was she doing besides going to school? That's a great question. How about I didn't get what I wanted for Christmas?
Hate when that
It does. What a bummer. What are some questions we could ask about that?
What did you get for Christmas?
Mm-hmm. Yeah, that's a great one. There's one more.
What did you want that you didn't get?
Yeah. And last one, my birthday is next week.
Aw, happy birthday.
Oh, good, thanks. What are some questions that we can ask about that statement, though?
Maybe if you're having a birthday party.
Mm-hmm. Yeah. Why don't we put that in question form?
Are you having a birthday party?
Yeah, perfect. What's one more question?
What do you want for your birthday?
Great, that's a great question. So these are just some examples of statements that you could hear in your everyday interactions with people. So for your homework, I want you to work on asking some follow-up questions to continue the conversation, to keep it going, but also to stay on task of what the person is talking about. So I really want you to focus on asking one or two questions every time you hear somebody make a statement, okay? Okay, great.
Scoring of patient performance is based on the client's level of independence for each task. A score of 1 would indicate that the client needed constant verbal and visual cues, additional explanation and/or modeling, and independently completed tasks between 0 to 20% of the time. A score of 2 would indicate moderate dependence on a verbal and visual cue, little to no explanation, modeling the majority of the time, and occasionally completes tasks independently, such as 20 to 40% of the time. A score of 3 indicates minimal cue dependence and independently completes tasks 40 to 60% of the time. The client only needed either verbal or visual cues and no additional explanation or modeling. A score of 4 is occasional cue dependence, only needing either visual or verbal cues some of the time, and no additional explanations or modeling. The tasks are completed the majority of the time, ranging from 60 to 80%. The highest level of scoring would be a 5, which would indicate a level that a typical person would be at. They would need no cues, prompts, or additional explanations to complete the task. Their independence level is between 80 and 100%.
Moving forward, once Jane exhibits reasonably good appreciation of pragmatic language skills, group activities including other patients in the outpatient treatment center will be included. Group communication activities are most appropriate for patients at RLAS level 6 or above. Jane meets this criteria. These activities provide a realistic context in which to practice interpersonal interactions within the stable environment of the treatment center. Feedback pertaining to appropriate and inappropriate behavior is often provided by group leaders as well as group members. Additionally, role-playing activities are often a part of group sessions, allowing the participants to act out and discuss daily life situations and exchange of opinions. Group activities provide a stepping stone toward the final stage of rehabilitation, which is community integration.
Social communication skills training is a treatment with proven efficacy regarding improvement in the pragmatic behavior of patient with TBI. There have been many studies regarding the efficacy of the training, which were cited in a randomized treatment and deferred treatment control trial by Dahlberg, Koswick, Hawley, Newman, Morey, Harrison Felix, and Whiteneck. This trial found a significant improvement in the overall life satisfaction and the pragmatic communication skills in the TBI subjects who received social communication skills training.